everyone. Happy Monday. Yes, it is Monday all day, and we have so much to dig into. Thank you for spending your time with me. We're starting in Nigeria today, where the president of that nation is mourning the loss of one of his own to COVID-19. This as the country also experiences a rise in unrest in parts due to the partial lockdown that's been put in place to halt the spread of coronavirus. I'm going to be speaking to a doctor there in the country to talk about the rise in cases, the growing instability, and just what the way forward is for Nigeria. In Ghana, it's a case of a sigh of relief from some, as that country's president announced on Sunday the halt or the partial lockdown of certain regions in that nation. Some Ghanaians, though, believe that the president's decision was made in haste. We're going to get an inside look at how the president reached that decision from the Minister of Information, who will be joining us shortly on the show. So stay with us for that. Spread the word, get people to tune in. I'm going to be speaking to Ghana's Minister of Information about the decision to end the partial lockdown in that country. And also, One World Together at Home. This past weekend, you may have seen either on your devices, your laptops, your iPads, or on television, depending on where you are, you would have seen that celebrities around the world gathered together with the World Health Organization to pay tribute to frontline health workers and to raise money for their efforts. We're going to be speaking to Global Citizen, the group behind the effort, their own Liz Agbor Tabi. We're going to be asking her what comes next. All of that and so much more. Let's jump right in. Okay. Africa has reached a grim milestone. More than 20,000 confirmed cases of coronavirus have now been logged, and more than 1,000 people have died. In fact, by my last check, we were approaching 23,000 cases on the continent. This past Friday, Dr. Michelle Yao from the World Health Organization's Africa region, if you've been watching the show, you'd have seen him here with me many times. He announced that we've seen a 51% increase in cases on the continent, 51% increase in cases. And in terms of deaths, well, those numbers have jumped by 60% according to the World Health Organization's Africa region. The surge appears to be happening across the continent, and that includes Nigeria, where 85 cases were confirmed on Sunday. All of this is happening as we get word from a local human rights group there in Nigeria that there's been an increase in complaints of military brutality as the country tries to enforce a lockdown in some parts. As you know, Lagos, the federal capital, Lagos, the commercial capital, Abuja, the federal capital, and Ogun State are all under lockdown. And now, according to this local human rights group, we're seeing a surge in complaints of military brutality. Let's discuss all of this. The growing numbers. Let's talk about the apparent rise in instability and the fact that the president lost his chief of staff. Let's talk about that with my guest, Dr. Kunle Onakaya. He's the Chief Medical Director of Lagoon Hospitals in Lagos. Dr. Onakaya, thank you for being with me.
Well, good afternoon, Isha. Thanks for having me.
You're so welcome. Thank you for taking the time. Let me ask about your hospitals, Lagoon Hospitals, which are private. For you guys, what are the protocols in place if someone turns up at one of those facilities and the fear is that they may have coronavirus or, they're presenting symptoms? What's the procedure? What are the protocols?
Well, I think we are luckier than most because we had a bit of a head start. So we could learn from how the rest of the world had coped with this. And from about the first half of March, it was obvious that this disease was going to come. So we had put in place processes. We had adopted the WHO screening tool. At that time, temperature, respiratory symptoms, travel history were the more important parts of that screening tool, but we had adopted that. We had put in place an isolation unit outside of the hospital, outside of the main hospital building. And the protocol at that time was if you ticked any of the boxes on that assessment tool, then you are directed to that isolation tent, and that is where somebody in full PPE will do the preliminary examinations. If there is anything that is remotely suspicious, then of course we will be forwarding you on to the state system. The other thing we had done was, because we are not allowed to test, well, we don't have the capacity to test ourselves in the hospital, we had used chest CT scans. So even if you don't tick all the boxes, if you don't tick the boxes in that assessment tool, but we still have reasons to suspect, then the protocol was to then take you through a chest CT scan. CT scans, because science certainly says that the appearance of the CT scans are quite typical for COVID-19. Again, from about mid-March, we had made it mandatory for our staff, the immediate front-facing staff, to go through very rigid protocols, PPEs, face masks, and we had started providing sanitizers for staff, sanitizers for patients, masks for patients, and all that. And by the time we then got to the latter end of March, we started doing remote consultations, so which is where we are now.
How much fear is there around this disease there in Nigeria as your staff talk to patients, people turn up at the hospital? Talk to me about that, what you're witnessing.
I think initially, in fact, that was the concern, was some mixture of unbelief and complacency, and the kind of it is someone else's problem and not mine syndrome. And that was a bit of a worry, because that was almost always going to promote the spread. But we have moved away from those early days. What is now even the bigger concern is all the stuff that are on social media.
Misinformation.
Exactly. So neither is good, but that is where we are now.
And so with that being said, what does the death of the president's chief of staff, how does that alter people's understanding of this disease there in Nigeria? Well, what's been the response? What type of reaction are you hearing?
Well, both ends of the spectrum, really. In one way, and that I think every death is regrettable, and one commiserates with Mr. President and Mr. Kyari's family. But having said that, I think the response is at both ends of the spectrum. There are those who it will still play to the narrative that this is the disease of the upper echelons of society anyway, and it has nothing to do with me. I have more to fear from hunger and loss of income than from COVID-19. But I think at the other spectrum, it then also, in a very, very high-profile way, brings it home that this is a serious condition. If someone who has access to the best care the land can offer could succumb to it, then, hey, this is something to take seriously. So it depends on what one takes out of it. I think that it will help to focus attention, both from the government point of view and from the citizenry point of view, on the fact that this is a problem that is here with us, and really it has no regard for status, it has no regard for anybody.
You mentioned the government's focusing the government's attention. So talk to me about the response and how satisfied you are with efforts to test, to isolate and contact trace. Give me your assessment of the strategy and how well it's working right now, because testing is still relatively low there in Nigeria.
Well, one thing is clear is there is no one who could ever have been prepared for this kind of onslaught. So yes, testing is low in Nigeria, but so in many other parts of the world. We relate most closely with Lagos State because that is where we are. And I think Lagos State is better prepared than most. They had a lot to learn from Ebola, so it was really easy to be quick off the mark and to revamp all that they had in place for Ebola. There was the hospital that was there in waiting, which could quickly be converted to an isolation center. They had a team in place very quickly. Yes, with regards to what percentage of the population has been screened, testing is still very, very low. One suspects that the low numbers we are seeing is because of the very low percentage of the population that is being tested. But again, as more and more people are being tested, obviously we are going to see the numbers going up. And I think in the last 3-4 days, we've probably seen close to 200 new cases. And it probably took us maybe a month, better part of a month, to record that much. If you see what I mean. But I think Lagos State we get a lot of guidance from them. They are in the face of contact tracing now. Rightly so.
How robust is that contact tracing?
Well, the good thing is that it's being decentralized now, and it is taking place. Contact tracing is now decentralized to local government levels, maybe what you will call county levels, and they have various teams in place to go to do contact tracing. So I think, yes, on paper, the response has been good, but you can always say that it hasn't been fully tested yet, again, because we are not seeing the really, really high numbers. I think this week and probably the next will be the real test.
So why do you say that? Why do you use that window?
Well, because if we use the experience of other countries, we are certainly seeing a rise in the number of new cases diagnosed on a daily basis. And that has been steady. There's been a steady increase in the last 3-4 days. When that happens to other countries, the trajectory of the graph grows northward very steeply. So one fears that might be where we are in the scheme of things. But then again, because the numbers have been low generally, one just hopes that we won't see that kind of deluge. But that's what the experience from other lands tell us.
And let me ask you this, how much is the government's effort, and I don't know if this information is being shared with you, how much of this is being guided by modeling, by, real-time modeling? So you mentioned the graph. Do you have any understanding, or has that information been shared with you or others in the medical community about where Nigeria is in terms of a timeline, in terms of a peak, in terms of, just where they are in the trajectory of all of this? What do we know in terms of the hard data analysis?
Well, there is a daily press briefing. It's not as strong nationally, it's not as strong on data as the Lagos State briefing. Certainly, the Lagos State briefing comes complete with graphs, complete with projections, where we will be if we don't keep to social distancing, where we will be if we're able to flatten the curve, and where we are now. Certainly, all that information is available. How testing can impact the graph. So yes, there is as much information as one will get when you look at the international news networks.
And where
from the Lagos State briefing.
For Lagos, you're there in Lagos. So where are we in terms of the peak and the curve for Lagos? What is it showing?
Well, pardon me if I draw most of my, should I say, answers from what happens in Lagos. Again, that is where our hospital is.
No, that's fine.
There is a lockdown, so that is where our clientele will come from. We think we are probably at the beginning of that upward trajectory. We think it could go both ways. Again, just taking a cue from the briefings from the Commissioner of Health and Mr. Governor himself. But we think we are somewhere at the beginning of that upward curve. Can it still be impacted? Hopefully so.
The lockdown. I want to talk to you about the lockdown that is in place in Lagos that you just referenced, and in Abuja and Ogun states. It's been in place. It was extended last week. There is growing rumblings, some places it's louder than rumblings, discontent with the hardships that are being caused by the restriction on movements. How concerned are you that this will spread? And this also comes as a local human rights group is complaining of growing military brutality to enforce these lockdowns. How worried about you when it comes to the issue of social stability?
Well, I mean, that fear is there. That rumbling, one gets the feeling that it is getting louder by the day. But I suppose there just might be light at the end of the tunnel. The extension of the lockdown is for another 2 weeks. We come to the end of that second lot of 2 weeks this coming weekend. If there is some form of relief, then that might just be all that is needed to calm things down. One, there is a heavy presence of the security, at least in the more urban parts of the city. A lot of the rumbling is in the peripheral parts. But again, when these things happen, nowhere is immune, really. One has a feeling that the security network will be as prepared as can be. But if I put on my doctor's hat, one tends to feel that, yes, while one can understand what is at the reason for the rumbling, if social distancing should break down, then one thinks there's going to be a really, really heavy price to pay. And I'm not sure that the inconveniences of lockdown is enough to pay that price, if you see what I mean.
Yeah, I do. These are difficult times and difficult decisions are being made, at all levels of society. Dr. Kunle Onakaya, I want to thank you so much for your time and for sharing your perspective. Thank you.
Thanks a lot, Aisha. Thanks a lot for having me. And you please keep safe.
Thank you. You as well. My best to all the staff at Lagoon hospitals. I know you guys well from my past time there with my mom when she was ill. So thank you.
Thanks a lot. Thanks for having me.
Thank you. So you heard Dr. Onakaya there from giving us his perspective from where he stands. The testing that's happening in Nigeria is being done by the government. So they're in Lagos, it's being done by Lagos State. There are no private commercial labs, if you will, conducting that testing. So that's an awfully big burden on the government itself. They're handling all of that. To date, the testing has been on the low side. Nobody, disputes that. But we are seeing this daily rise in cases. You heard Dr. Onakaya say that from the briefings that are taking place in Lagos State, they show that the curve there's an upward trajectory on that curve. And so the question is, how long will it take to reach the peak, and what it will take to flatten that curve? Those are the questions that we have, same questions that apply to everywhere in the world. That growing instability, is a great concern for every country. In Nigeria, we're seeing more and more of it, louder grumblings of discontent. So we watch that closely. I want to thank you for writing in already. Thank you for being with me right at the top as the show gets going. I'm very grateful to people writing in from Ghana, people writing from all over the continent. Ogbemudia Abunau says, we are here. Thank you for being with me. And Kade Mansoray, a regular, and also full disclosure, my cousin. She's writing in saying that she's watching. So thank you, Kade. Also getting messages from people. AB Sadiq Kanu says, this is why African leaders need to fix Africa's bad medical sectors and hospitals like the Europeans. We need to be prepared because we never know when we'll be tested, I think is the point you're making there. Thank you for that. Ibrahim S. Sesay, how do you trace contacts and identify people who may have had passive interactions with someone who has tested positive for the virus? This is where, the strategy comes into play. There's a protocol for the contact tracing. You try as best as you can to kind of map out everyone that infected person or suspected infected person has had contact with. You get that information and you just expand the circle. It's incredibly labor intensive. It requires a great amount of manpower. It is not a simple feat to carry out. So we can be under no illusions as to how difficult this is for governments right around the world to effectively test, isolate and contact trace. It is a huge undertaking. Daniel Nkrumah, Aisha, the only thing that saves Africa is the weather, because the corona cannot survive when it is very hot, if you looked at. Okay, so this whole question about the heat and what that means for coronavirus is unproven. The science is not in yet as to what this virus is doing in hot temperatures. And the question of information, proven information, is something that, you know, we take seriously here on the show, and it's something that we dig into every day. That point about Africans being complacent because of the heat, we need to do away with that. We do not know what this virus is capable of doing in Africa. We cannot, excuse me, take a position of complacency because it's warm. So Daniel Nkrumah, that's what the scientists are saying. Please keep those questions and comments coming in. I'm going to get to them. Excuse me, as I choke. We're going to get to them, and you know, we'll share perspectives. Your voice is absolutely critical to this show, so please keep writing in. Thank you. Okay, so you know, I think the point was made by my last guest that coronavirus has no respect for borders. It doesn't care about race or gender or power or privilege. What we've seen is this virus and its disease, COVID-19, spread throughout the world, and it leaves grief and shock in its wake. In the corridors of power in Nigeria right now, they are grappling with those emotions as the president's chief of staff lost his battle to COVID-19 on Friday. Abba was the president's chief of staff. He is known to many, referred by many as, you know, the most powerful person in the government. You know, that's how many referred to him. He was the gatekeeper to President Muhammadu Buhari. He's the highest profile person to die from the disease in Nigeria. In his 70s, he reportedly suffered from underlying conditions, and he'd recently traveled to Germany before testing positive for the virus in late March. This is what President Buhari said in a tweet. Let me read it to you. Malam Abba was the very best of us. He was made of the stuff that makes Nigeria great. Rest in peace, my friend. Our thoughts and prayers go out to all those mourning the loss of their loved ones. And we feel it's important on this show to acknowledge the loss and the tragedy, and particularly those that Africa is losing in this pandemic. Well, while tensions remain high in Nigeria as those restrictions with a partial lockdown continue, and those restrictions are making life increasingly difficult for millions across the way, if you will, in neighboring Ghana, somewhat different mood. And in part, that's due to an announcement made by the president on Sunday. Take a listen.
I've taken the decision to lift the 3-week-old restriction on movements in the Greater Accra metropolitan area and Kaswa, and the Greater Kumasi metropolitan area and its contiguous districts, with effect from 1 a.m. on Monday, 20th April. In effect, tomorrow, we'll see the partial lockdown in Accra and Kumasi being lifted. I must make it clear at the outset that lifting these restrictions does not mean we're letting our guard down. All other measures are still firmly in place.
So the partial lockdown in Ghana has come to an end, but the question for many is, was the decision hasty? Is the country ready for what could potentially come next? I'm pleased to say Ghana's Minister of Information joins me now. The Honourable Kojo Oppong Nkrumah joins us to discuss all of this. Honourable Minister, thank you so much for joining us. Welcome.
Thanks, Aisha.
So let me start by asking you about this decision to lift the partial lockdown there in Ghana. I know the country recorded 208 new confirmed cases on Sunday, and that was the same day that the president made the announcement of lifting the partial lockdown. The fact that you have such a significant increase in cases and yet have decided to lift the partial lockdown strikes some as odd. Can you explain how the president reached that decision?
So 3 weeks ago, the president announced that we were going to step up our response program beyond the preventive etiquette that we've been preaching and observing across the country, which is about washing of hands, social distancing, etc. We had also imposed a first level line of restrictions, closing schools, banning social and religious gatherings, closing our borders, among other things. We then went for what we call an enhanced testing program, which is a bit different from what many countries have done. The program essentially is not to wait for people to fall sick and come to hospital, but is to go out into what we call at-risk areas and test ahead of time. The view being that then we'll find persons in the early exposure bracket, which gives us a better chance of supporting them with treatment so that we don't get to critical stages and require all the ventilators, etc. And then finally, what we sought to do was to get ahead of the virus by imposing a partial lockdown in 2 of our 16 regions to give public health authorities an opportunity to do an aggressive surveillance program to find out what our early rate of infection or positivity rate was and what it takes to cut it down. That's what we did in a 2-week period. We gave them a target of about 10,000 at-risk persons to test. They have currently tested about 80,000 persons. Close to about 70,000 of those test results are in. And it tells us that our real early positivity rate or early infection rate is sitting somewhere about 1.5% if you put the various cohorts together. But if you narrow down to the core, about 1.09%. And so for us, the decision is this: what is a sustainable approach to cut that 1.09%? And our view is to do that in about 3 ways. First is to maintain the preventive etiquette and even enhance it. And so as of last night, Ghana has announced the wearing of masks across the country. And in the coming days, we're going to work towards ramping up the availability of masks for everybody to be wearing a mask. The science tells us that it is a major tool into cutting into potential infection rate. So if we're at 1.09, and in addition to the various measures that we are implementing, we're now saying that everybody should wear a mask, we're going to cut that 1.09 down a bit. Second is that we're maintaining all these restrictions which were imposed about 3 weeks ago. The data that we have had so far, yes, has a bit of a lag in it, but we're of the view that if we maintain all of these restrictions, close the borders, ensure that schools are still closed, public gatherings are banned, religious groupings are banned, no large activities there, we further cut into this 1.09.
So let me
third thing we're doing.
So before you go on, just so that we can follow along, because it's a lot of data you're giving us, it's clear that you have built a robust plan to tackle this, particularly with this enhanced testing protocol. But I just want to be clear, and that's the reason I'm interrupting you. So forgive me, Mr. Minister. You are testing people who are displaying symptoms. I want to be clear on this testing mechanism, bearing in mind significant numbers of people are asymptomatic. So I want to be clear on how accurate your picture is there in Ghana.
Yes. So for the persons that we are testing in this aggressive surveillance bracket, they are not people who are symptomatic. Many of them are persons who don't even know that they have had early exposure. What we've done is to do a mapping of what we call the at-risk areas, some of the hotspot areas, some of the persons who have come into contact or are thought to have come into contact, even third-line circles of some of the initial cases. So the majority of people we are finding in this enhanced testing bracket are asymptomatic. Many of them do not even know that they have had exposure. And as we're able to test them, find them positive, and then provide them with the supportive care, we are better able to manage that. And that brings us to the third part of our strategy, is to further enhance even the enhanced testing regime we have. You notice that today Ghana is leading in tests per million of a population within Africa. We want to take that a notch higher by bringing on board a lot more labs, private labs, and then also by using rapid diagnostic tests as a first wave. Our belief is that this will even deepen our ability to find any potential early exposure and quickly capture it. And if I just may give you some data. So as I speak to you this evening, 1,042 cases have been recorded in Ghana. The breakdown is that 383 is what comes from the ordinary or the general surveillance that we were doing initially. Since we started enhanced surveillance, we've recorded 544 more positives that are mostly asymptomatic, did not even know that they have been exposed.
Let me jump in there. So as you give me that data about the 1,042 cases, what I also took note of in that data is that you're registering only 9 deaths, which, you know, is compared to other places, that's on the low side, and we're thankful for the minimal loss of life. But you still have 934, according to the data I saw, still listed as unrecovered. So talk to me about the severity of cases you're seeing there in Ghana.
So only 4 persons in Ghana are currently in critical condition. The 930 that still remain are persons who are described by the doctors as well or responding to treatment, because a majority of them were even asymptomatic at the time we found them. And that's the value of the enhanced testing at a very early stage, so that you find persons with early exposure, even when they are asymptomatic, and support them. Ghana has also got a very stringent, may I say, protocol for determining those who are cured. We do 2 negative tests before we declare you recovered or cured, and then we move you out of the bracket. So out of this 934, 4 are critical, 930 are well and responding to treatment, but a number of them have already tested once negative. We are just going through the 7-day wait period, and then run them on a second test.
But let me ask you,
it becomes quite clear that enhanced testing is what is helping us to find a lot of these numbers. And therefore, the decision by the state is that we need to do a lot more of the testing, a very aggressive testing program, which can be done even when a lockdown in these 2 out of the 16 regions is lifted. And that's how we arrived at that decision.
And I appreciate your thoroughness in going through the numbers. It was important for people to get some perspective. Where are you in the curve? What is the modeling showing? So
that becomes an interesting paradigm. Which curve are we talking about? Are we talking about the hospitalization curve, for example, as you see, I think in New York, as they keep talking about? Are we talking about the curve of the rate of new infections per day, which in different jurisdictions you have difficulty in calibrating? Are we talking about the active case curve, in which case for Ghana's situation, 1042 minus 99 minus a potential chunk of the 930, we would say that is down. But for us, here's what we're actually looking at. Our early infection rate is about 1.09. Our estimate is that the plethora of interventions that we're rolling out should help us cut into that 1.09, and even for the residual numbers, find them at a very early asymptomatic stage and ensure that they get support. That is the approach that Ghana is using.
So those who are saying that in lifting these partial restrictions, as the president did on Sunday, that it was putting too much faith in people's willingness or ability to observe social distancing and to wear masks, you say what?
We say that we have a fair amount of faith in them, but we are also policing that faith. And that is why in the coming days, Ghana's security agencies that are now shifting from policing the lockdown will now move to policing the enforcement of the restrictions, the general restrictions as have been introduced, to ensure that we do a better job at complying with these interventions.
The other charge being laid at the doorstep of the Akufo-Addo administration is that this move was made not really because of data, but given that this is a fast-moving situation, and that it's about politics because there's an election coming at the end of the year, and some are pointing to this being about trying to strengthen the government's position, the government's stand. How do you respond to that?
If I have seen anything in how we've handled this so far, right from the very beginning, we have looked to the way of data and science and not politics. In the very beginning, the administration came under a first charge of not being quick enough to evacuate Ghanaians from China. And a lot of political pressure was brought to bear on the administration, and it appeared expedient at the time to just organize an airlifting mission because that appeared to be the popular and politically expedient thing to do. But the president was quite clear that in consultation with the epidemiologists and the infectious disease experts, the science did not suggest that that was a smart thing to do. We didn't follow politics at the time, we followed the science. A few weeks ago, when we announced the partial lockdown, we prior announced that it was to afford the public health experts an opportunity to gather data on early infection rates, on what it takes to cut down that rate, on the dynamic of the virus here in Ghana, on the geographic footprint of it. We laid all of that out about 3 weeks ago. 2 weeks ago, when the data was not complete, the president asked for a 1-week extension and explained that it was to afford the public health workers an opportunity to complete that data. It's therefore absurd that when that data is together, and again we look to the science, somebody yanks an idea out of the hat that he or she believes that it is for political considerations. I have been in the room, in the situation room, when the team of experts have been advising the president, and at no single moment was there a discussion of elections or a discussion of national registration. So you can discount that 100%. The decision has been driven by the science.
Thank you for that forceful response. When we look to the future and we look to this new effort, enhanced testing, policing, people wearing masks and observing social distancing, what areas in the country are of particular concern? Where are you looking? Because we spent a lot of the time talking about Accra and Kumasi, the two biggest cities. I mean, how robust is this protocol throughout the country, and where are the hot spots potentially?
Accra and Kumasi, yes, you are right, the epicenters, if I may borrow that expression, and therefore a lot of attention is going to Accra and Kumasi. But the president is also being clear to other regional ministers and other mayors to now also look at it from a district response approach. At the various district levels, they have put in place their district health emergency committees and are on standby. And what the president has instructed is that as we continue to observe, even moving forward, if we're reason to believe that the protocols are not being respected in a particular place, or that we are getting spikes in a particular place, not only are we going to come in with a soft, or may I say partial lockdown, we're going to have to come in with a lockdown and curfew, which is like a mandatory quarantine of that entire district to go in aggressively and deal with it. You would notice that, Aisha, in all of these things, balance is the rule of thumb that we're having to work with. So if I borrow the narration that I think the Prime Minister of Austria gave, you allow as much freedoms as you can and impose as much restrictions as are necessary. And that's how we're handling it under the current circumstances.
And to other nations that are looking to the situation in Ghana, clearly your administration, the administration feels somewhat confident in its abilities and in being able to track this. Do you have any again, best practices, lessons learned for other African nations. Every country has its own specific nuance and context. I want to be clear on that. But in terms of what you've learned so far from this effort to get to this point, do you have any advice for neighboring countries for the continent as a whole?
Ghana's strategy has been in 5 major parts. Maybe that would be the best guide that we can share with other persons. First of all, our idea was to limit importation at a very early stage. Second, our strategy has been to ensure that lateral spread or horizontal spread is contained. And to do that, these are the 4 major things as I outlined to you earlier. We've also been working to ensure that we produce a lot of logistics locally, because logistics are in global short supply. So it's important to produce logistics locally to deal with it. And then we've been trying to mitigate the impact of all of our measures on the vulnerable and the homeless as well through a number of social intervention programs. But one of the key pillars that I think other countries or all of us need to look at is to let the science direct the next steps. So go in hard early, get as much data as you can, and let the data and the science guide the next steps. You need a combination of discipline, of public education, and of law enforcement to carry the country along. We are cautiously optimistic that we'll have a good story in the end.
Well, we certainly hope so. We hope so for the continent as a whole. Minister of Information, Honorable Kojo, Oppong and Nkrumah, thank you so much for giving us so much of your time. Thank you. Fascinating insight into Ghana's handling this pandemic and their multi-tiered approach when it comes to the testing, the isolating, the contact tracing, this enhanced testing that they're going for now, mapping out at-risk areas and going after the testing of individuals who are asymptomatic. It is certainly really interesting to hear the decision making and to be taken behind the curtain. Obviously, you heard me ask a question about politics, because that is a charge that has been laid at this administration, that the move to end the partial lockdown was taken too quickly. The Minister of Information, they're stressing that this has been data driven, and that, when you look at the number of cases, there are 142 cases, 934 still listed as unrecovered, but only 4 of the 934 listed as critical. So, his position that, when it comes to treatment, when it comes to hospital admissions, they're on the right side, and that there are many curves that one could refer to in this situation. I want to go back to your comments, and I want to say thank you for the fact that you are with me still and writing in. This from Alice Tumodlu, finally a public official who gets it. Data, data, data. Cannot stress that enough, that we need to let the science guide the effort. And according to the Ghanaian government, according to the Minister of Information, they're letting data drive their efforts and how they build a strategy. Isaac Owusu-Dua says, I just love this minister. Support for the Minister of Information there. Looking through, Ibrahim Lansana, I hope our Sierra Leone Minister of Information will be hosted on this program this week to give us an update on the coronavirus pandemic fight in Sierra Leone. We are reaching out to all governments. We want ministers of information, heads of state. We want to be able to bring their voices, their decision making directly to you. So that is a key focus of this show. So no worries with that. We are reaching out to everyone, and we hope they'll join us here soon. Aminata Radiasai says, data, science, and discipline indeed. The minister's approach, Ghana's essentially is sound. It is impressive. Ona Wuhu Twama says, I'm really delighted that you're allowing the data to speak. The only solution to the coronavirus is a public health solution, not a clinical solution. Keep testing. This is the only way. However, please take note that some people will always test positive for many, many weeks, even after treatment. You need to make plans for these people. Really good point, Ona. Thank you. Hindoa Saidu says, my country, Sierra Leone, should learn from the Ghanaian model. Mohammed Sharif says, great update from the minister. I am grateful for all these comments that keep coming in. Please keep writing in. I'm going to get to as many of them as I can. So I agree. It was really very, very interesting to hear from Ghana's Minister of Information and to hear his tips to other countries on the continent for dealing with this crisis. All right. So moving on from the situation in Ghana and turning to an event that you may have been watching over the weekend. It was a global citizen effort. It was a global citizen effort which brought the biggest stars from around the world together to champion the work of frontline healthcare workers and to aid the World Health Organization in their fight to end the coronavirus pandemic. So from Lady Gaga to the Rolling Stones to John Legend, everyone appeared across several hours of the show to share their words of encouragement, including actress Lupita Nyong'o. Take a listen.
If you've never been to the African continent, you might not realize how diverse it is. There's 54 countries, over 3,000 ethnic groups, more than 2,000 languages. That's a lot of difference to navigate. And yet all across the continent, we are united by the resilience of our spirits and the resourcefulness of our minds that have helped us through many challenges. Today, as the whole world comes to terms with COVID-19 and cases in Africa are on the rise, we must remember that though we keep each other safe by practicing social distancing, we cannot afford to emotionally distance ourselves. Keeping everyone safe and healthy requires strong local and global ties. We must remain vigilant and make sure that all communities in Africa and around the world have access to life-saving testing, protective supplies, and treatment. Let's continue the fight together until COVID-19 is gone.
Actress Lupita Nyong'o there, and bringing together all of those celebrities was no small feat. Behind the effort was Global Citizen, a US-based grassroots organization that has long been fighting to bring to an end a number of the social ills of our time. They have been on the front lines of this effort to end global poverty, to advocate for clean water, for sanitation, for girls' education. They've been working in this space for many, many years. And according to the WHO chief, Dr. Tedros, what they did was remarkable, and this moment is bringing out the best in all of us. Take a listen.
COVID-19 has taken so much from us, but it has also given us unique opportunity to put aside our differences, to break down barriers, to see and seek the best in each other, and to lift our voices for health for all, and to ensure this never happens again. Never again. The World Health Organization is proud to be part of this historic show of solidarity.
So now it is all over. The question is how much was raised, because there was a fundraising element to all of this. How much was raised, and what difference will it make to frontline health workers? What difference will it make to people like you and I in this battle? Joining us now is Global Citizens' Liz Agbor Tabi. She's the Vice President for Global Policy and Government Affairs. Full disclosure, she's also a friend of mine. Liz, did you just disappear?
I am right here.
Liz Agbor Tabi, welcome to the show.
Thank you, Aisha. Thanks for having me. And thanks to you, I put lipstick on today and I'm joining the Zoom lipstick revolution, a coin termed by a dear friend of mine in Lagos. I'm proud to represent that revolution.
Well, we want to see your lipstick because your video has just disappeared. So where are you? Where have you gone?
Oh, boy. Let's see.
This lipstick revolution.
Yeah, there's a Zoom lipstick revolution. But
I'm not having any part of that. Liz, tell me. I mean, listen, I watched the effort, and I have to say, I just kept thinking of all of you at Global. Obviously, I know a lot of the team. I've worked with you guys in the past, so I know a lot of you and how hard you work. That was a tremendous effort. Let's start with, what did it take to pull it all together?
Wow. Well, thank you so much. When we envisioned One World Together at Home, Global Citizens set out to create a show that could achieve three primary objectives: to create a moment of global unity and solidarity, to offer great entertainment to our at-home audience while supporting the World Health Organization as we all practice social distancing, and to commend the incredible acts of bravery of frontline workers at the center of the COVID-19 pandemic response. And so we worked in partnership, curated by Lady Gaga, hosted by Jimmy Fallon, Jimmy Kimmel, and Stephen Colbert, and through 8 hours of coverage with more than 60 global broadcast networks across more than 175 countries, 9 digital streaming platforms, and hundreds of affiliates, we were able to reach billions of viewers. I believe we created a historic moment, and we had a diverse representation and a really inclusive group of artists, activists, and we were able to reach out to individuals across geographies, across time zones. I was especially heartened when I received messages from friends across multiple time zones who had been up through the wee hours of the morning, 3, 4 a.m. in some parts, watching the show and just reaffirming this solidarity across humanity, which is really needed at a time such as this, a very difficult time, arguably, for all of us across the globe, regardless of where you are.
Yeah, absolutely. Difficult time, and it was really heartening to see people pull together, again, from around the globe. There was a fundraising piece to this. Talk to me, how much money was raised? And critically, as always with these efforts, the question is, where is that money going? How is it going to be used?
So through our efforts on Saturday, this wasn't a telethon. This wasn't a traditional telethon where we were asking individuals to call in and make donations. But we had worked with governments, with philanthropists, with the private sector to get commitments towards the COVID response. And we were able to raise $128 million through our efforts. And these funds will go in part to support the WHO's COVID-19 Solidarity Fund, which is providing critical supplies to communities most in need. These funds will also support workers at frontline workers, which are not just the doctors and the nurses that are keeping our hospitals running, but the mail carriers, the grocery store clerks, the individuals who are facing adverse risks to be able to provide us continuity of services. A lot of the funding that we raised also will target local community service providers, which was really one of the most essential aspects of this campaign, to be able to impact on a global scale, but also to impact at the local scale.
To those who say, celebrities, what's the value of celebrities, and why was there a need to use their spotlight? I mean, talk to me about the unique combination of this platform and what you were able to do using this model that would just have been harder otherwise, and like that unique USP of what Global Citizen does.
Through a very inclusive representation of artist activists. Most of the artist activists that we had on the show feel personally connected to this cause, to raising awareness around COVID-19. Many have been impacted by COVID-19 and really wanted to be a part of this movement. They volunteered to use their voices to help us to raise these funds. I think it's really, our hope was that viewers would walk away believing that as a shared humanity, we can emerge from this moment. You know, forever grateful for the work of doctors, nurses, teachers, grocery store workers, and all those who are the backbone of our communities. And just with the notion that we cannot defeat this virus alone, we must come together as a global community, individuals, governments, the private sector, celebrities, to address the current crisis and stop another pandemic before it starts.
Your background is public health. I know you're originally from Cameroon. I'm asking you to swap hats for a quick second. I mean, what's your take on the situation, you know, there in Cameroon? What stands out for you right now?
Aisha, you know, with rapid urbanization and informality on the rise, Africa faces a unique challenge, Cameroon included. You know, in some countries where upwards of 60 to 70% of the population are engaged in informality, whether that's economic or living in informal habitats and lacking the social safety nets that are critical for mitigating a pandemic such as COVID-19. The question is, how do you shelter in place when there are multiple dwellers in a single room shack for individuals living in informal settlements? How do you isolate in place if you are not working and that means your family starves? You know, but Aisha, this isn't just a Cameroonian or an African or global North problem. With rapid urbanization and globalization, this virus has demonstrated that a threat to a community anywhere in the world is a threat to each and every one of us, and that our health system is only as strong as the weakest health system globally. So that's why I think it's important to support multilateral organizations like the WHO, who are able to focus on building resilient health systems around the world to ensure access for all. Organizations like Gavi, the Vaccine Coalition, and CEPI, the Coalition for Epidemic Preparedness Innovation, so that once a vaccine is available, it's available for all, regardless of income, geography, or opportunity.
Yeah, so well said. Liz Agbor Tabi, always a pleasure, especially to see you with lipstick on. It's, you know, although I've never seen you without lipstick, but
but now this is the Zoom lipstick revolution.
Thank you for the work you and the entire Global Citizen team did this past weekend, and I know the work you'll continue to do. Can't wait to see what comes up next. Thank you so much, my friend. Be safe and love to the family.
You as well, Aisha. Thanks for having me.
Thank you. Take care. Bye. It was truly remarkable. If you, I mean, all of these celebrities. If you've watched a Global Citizen event before, they managed to convene the biggest stars, and they come together with their hearts, their voices, to really shine a light on the world's most pressing issues in this moment, of course, the coronavirus pandemic. So if you watched what happened at the weekend with Global Citizen, hopefully it took your mind off these trying times we're living in. That's something we try and do every single day here on this show, Home with Isha Sesay. We try and take your mind off the craziness of this moment and just help you kind of get a different perspective. Today's bright side, that's what we call the segment. Today's bright side is a pro at navigating an African city. Take a look.
You know, the business opportunities. Now, the business opportunities are reason enough to move home.
High risk, but high return.
I actually make $30,000 per sale on each container of shea butter I ship to Minnesota. The exchange rates here, though, killing me.
$30,000?
Yep.
That's my entire yearly salary at USAID.
Yes, the beautiful, the talented, and very funny Maame Adjei will join me in just a moment over on Instagram. But before then, she's giving us an insight into how she's coping with life under lockdown. Take a look.
Hi everyone, this is Maame Adjei We've been in lockdown here in Accra for 3 weeks, and today the lockdown was actually lifted, but I'm planning on staying put for a little longer. And what I've been doing is just really connecting with myself, catching up with friends and family, something that I was not doing well at all before this started. Connecting back with the things that I love, like actually playing my vinyls and reading and Netflix binging. It's been a really roller coaster time for me emotionally. Some days have felt really inspiring and productive, and other days have just felt like I was being closed in. But we're pushing through, and I hope everyone out there is safe and looking on the bright side and trying to be positive. And I'm really excited to speak to Isha tonight.
She's so wonderful, and I can't wait to hear more about how she's doing. She mentioned playing vinyl. I'll talk to her about that. And just, her honesty that some days are good and some days are bad. And I think we can all attest to that. I'm going to be over on Instagram in about 3 minutes or maybe 30 seconds. I'm talking live to Maame Adjei, so do join me for that. Send your questions, be part of that conversation. For me, right here on this platform, that's it for today. I'll be back tomorrow at same time, same place. More great interviews, more insight. Do join me. Be home with me, Isha Sesay. Hope to see you then. Bye for now.